And now Murang'a and Kirinyaga County governments have temporarily ordered the closure of their respective county headquarters, citing increased COVID-19 cases. Kirinyaga County Governor Ann Waiguru says the county government will for the next 2 weeks facilitate the testing and screening of staff with a view of stemming the spread of the virus. The development coming even as Kilifi County government announced a raft of new measures that are aimed at curbing the spread of the virus in the county.
What are you doing? A section of Kirinyaga and Murang'a County employees will for the next 2 weeks work from home as the two counties grapple with COVID-19 infections within their nerve centers.
We'll still be offering essential services, as you are aware. There are departments that have to operate. We are keeping a very skeleton staff at the moment so that we address this issue.
Murang'a and Kirinyaga announced the closure of their headquarters after some employees tested positive for COVID-19.
Effective today, we have scaled down our operations at all the county offices due to increased cases of COVID-19. Some of our staff have been affected, even our frontline workers.
The move comes even as counties continue to be faced with the reality that the second wave of COVID-19 is spreading fast in the grassroots. The Kilifi County government announcing new measures aimed at stemming the spread of the virus in the county.
Kile ambacho kinasababisha ongezeko la idadi ya watu ambao wanaambukizwa virusi hivi ni kwa sababu watu bado wanatangamana. Na kama tujuavyo, virusi hivi vinasambazwa kwa urahisi wakati watu wanatangamana. Kwa hivyo hiyo ndio changamoto kubwa ambayo tumeipata kwamba inachangia pakubwa katika kusababisha ueneaji wa maambukizi haya.
County governments have in the recent weeks been accused of doing little to protect healthcare workers against the deadly virus. The National Nurses Association calling for dialogue to avert a planned strike by frontline health workers, demanding better protection in the line of duty.
Because of this high surge of infection amongst health workers, we are seeing statements here and there about labor unrest. We want to pray that it is never easy. It is never the solution to have a labor industrial action in a health care setup. We want to pray that all those issues that have been brought forth by the leadership, my colleagues in the healthcare industry, we can sit on a table and iron them out amicably without disrupting the services to the wananchi. And I'm sure this one can be done.
Healthcare workers have pointed accusing fingers at both the national and county governments for allegedly leaving them exposed in the war against COVID-19.
Our hospital's aim is to protect our frontline workers and also our patients in tandem with our tagline, which is "We Care." The life of frontline workers matter, without whom the battle against COVID-19 pandemic will not be won.
Medics have vowed to down their tools should the government fail to address their irreducible minimums, which include the provision of effective personal protective equipment and employment of more personnel to reinforce Kenya's war on COVID-19. For Channel 1 News, I am Emily K. Bade.